Showtime!
Ladies and gentlemen, please make your way to your seats.
Showtime!
Please make your way to your seats. The show is about to begin.
Showtime!
Let the magic begin.
Move over graphene. Borophene is here. Better than graphene, this material development may improve implantable technology. So what's going on with this, Jon?
Yeah, so based on the article that I was reading, so the researchers apparently have synthesized the first chiral form of 2D borophene and have shown its potential for advanced biosensors and implantables. So borophene has, and obviously borophene is, as you know or may not know, is derived from boron. So borophene has several advantages over graphene, like higher conductivity and flexibility. So what they did was they imparted chirality to borophene using amino acids, which allow for specific binding configurations. Now, chiral borophene interacts uniquely with cells and proteins based on its handedness. So the programmable biointeractivity, what it could do is it could enable a new generation of medical implants and imaging capabilities. Controlling the thing about this, though, is controlling the material cell interactions is going to be key for safer and more effective implantables. And the cells were found to uptake the chiral borophene platelets in ways dictated kind of by their shape. So it's really interesting. The thing is being able to chiralize borophene opens up an entirely new realm of biointeractive electronics. And this article kind of just scratches the surface of what can be done. But the synergies between material science and biology in this article, and we've covered this before, it just continues to accelerate innovation. So the breakthrough in synthesizing unlocks a lot of new biomedical applications. And again, this is new research, breaking research, bleeding edge research. So it's going to be interesting. The one thing to note is synthesizing borophene itself. It's extremely challenging. So adding chirality just further increases the complexity. So this breakthrough just demonstrates exceptional material chemistry capabilities. Really, really cool stuff.
So graphene is used in a lot of things. And you said a word there that I'm going to mispronounce. What does it mean to impart chirality to
chirality?
Chirality. What does that mean?
So it's I'm still having difficulty wrapping my head around it. So I'll try to explain it as best as I can. Borophene, it's a 2D material. It consists of a single layer of boron atoms arranged in a lattice structure. So just like graphene is a 2D form of graphite, borophene is the 2D form of boron. The key difference is that while graphene has a flat honeycomb lattice of carbon atoms, borophene has a more buckled and asymmetric type structure. I don't know if you could bring up a picture if it shows it there. I don't know. Probably not. But this gives borophene some distinct properties like metallic conductivity, flexibility, and reactivity. Now, chirality refers to molecules or structures that are non-superimposable on their mirror images, similar to how your hands are kind of chiral, okay? So certain arrangements of atoms can make a material chiral if it cannot be perfectly superimposed onto its mirror images. So in this case, the researchers were able to synthesize borophene such that the arrangement of boron atoms gave the 2D materials a chiral form. So the boron lattice itself lacked mirror symmetry like what's found in graphene. So imparting chirality, what it does is it introduces capabilities because it allows the material to interact differently with other chiral structures like biological molecules. So for example, certain proteins and cell membrane components also have chiral molecular structure. So by making borophene chiral, the researchers enabled it to selectively bind and interact with specific biological structures based on their handedness. Think cyborgs, if that makes sense. Think cyborgs in this case, right? So the ability to precisely control interactions between an engineered material like borofene and biological systems, it opens up many possibilities, which is why introducing chirality dramatically expands the potential applications of this.
So I have a picture from one of the abstracts up on the screen for people to watch, and it kind of talks about what you were saying here. I'm not sure if people can get it from this picture, but it is what what we can pull up. Yeah. All right. So we talked about chirality, and so this is supposed to replace graphene potentially in implantable things.
Yeah.
So what kind of biosensors and implantable devices specifically could benefit from this?
Yeah. So there's examples that right away that come to mind. So implantable glucose sensors. So the chiral brophene could allow accurate and non-invasive monitoring of blood glucose by interacting with glucose molecules, which is really cool. You could have cancer sensors. So the chiral detection of cancer biomarkers could enable ultra-sensitive diagnostic implants and skin patches. Cardiovascular stents. So flexible borofene coatings could improve biocompatibility and integration of artery stents, joint implants. The cool thing, the one that I like, is drug delivery patches. So borofene's reactivity could allow on-demand release of drugs through the skin, which is really cool. You could have biofuel cells. So chiral electrodes made of borofene could provide implantable power sources, which is cool. I think we were talking about a power source in a previous episode, or you and I were talking about it. I can't remember. Lab-on-chip sensors. So their thinness suits miniaturized integrated biosensors, wearable sensors. There's tons of potential applications for implantable devices, for sure.
We were talking about, I think, clothing that had like tension stuff that as you moved, it could charge a while ago.
That's right. Static. Yeah.
Borofene's unique structure allows for effective magnetic and electronic control, noting that material could have additional applications in healthcare. To study, you're saying it has biosensors, drug delivery systems, and imaging applications. Do you know anything about the imaging applications? What would you use that for?
It didn't specifically state in the article, and I couldn't really find much. But I do know that. So if we're talking about imaging, so the thing where I could see borofene, the reason why they're talking about imaging is because borofene's sensitivity to sensitive electronic properties. So it could absorb chiral molecules and could be leveraged to create more sensitive, more detailed kind of images. So it could enable kind of next generation optical metamaterials because of the sensitivity that it has. But I'm not too sure. I'm not too sure the specific use case for imaging itself and the actual details in that. No.
So have they tried putting this in a human? Do we know anything about the toxicity levels? Does our body reject having this stuff in? Do we have to do anything special? Long-term impacts? Yeah,
we're definitely going to have to. So it's a new material. So it's still like the biocompatibility is being studied and tested. So there's no long-term clinical data that exists yet. The initial cytotoxicity test showed that chiral borofene does not significantly reduce cell viability, which is compromising. So being composed of boron, it is less likely to be reactive, compared to metals like iron or copper that can cause damage. So long-term effects need to be studied. Impacts of its nanoscale and shape on tissue interactions needs evaluation. They need to test irritation, sensitization, potential immunogenic responses. There's a bunch. So it is encouraging, but extensive studies are going to be needed for this to determine whether it's safe for routine medical implantation, long-term use, everything. because this is so new, they have a long way to go.
And what makes this so much better than graphene?
So what makes this so the difference is graphene is a zero gap semiconductor with extremely high electron mobility and conductivity. Now, borofene is also highly conductive, but it has an even higher predicted electron mobility than graphene. It has a metallic type conductivity where graphene doesn't have that. So it also has an unusual cone in its band structure, which leads to direction-dependent electronic properties, which graphene does not. The mechanical properties, they both have exceptional strength. The one thing, though, with where graphene is ahead is it is stronger and stiffer of the two, but borofene is more flexible than graphene. That's why it's going to be great for biosensors and things like that. It also has excellent mechanical stability compared to other 2D materials, even like silicon, which is the 2D version of silicon, for those that don't know. But graphene can be produced a little more reliably and affordable, like methods with CVD. But graphene production has been around a lot longer than borofene. So borofene just needs to catch up. But they have both. They have applications. They have both advantages in different applications, if that makes sense.
Yeah, and it looks completely adaptable. It was comparing it to Lego. You can make whatever kind of structure you want out of it. So we've seen the first Neuralink implant. We've seen some interviews with the person who was the first survived implant or what have you. Are we going to see this type of thing applied to that? And when? Like, are we going to see this in medical devices in our lifetime?
For sure. So if we're talking about timelines, so let's talk about kind of next steps. So in the near term, they're going to have to test it further for toxicity, for medical use. They're going to have to develop some biosensors and test those. I'd say that the next 2 to 5 years. In the next 5 to 10 years, maybe implement it for non-critical consumer biosensors and wearables. Clinical trials are definitely going to happen for simple implantable borofene sensors. And then obviously coming up with some coatings for better tissue integration and things like that. And then 10 plus years out, again, regulatory approval of more complex kind of implantables. And that's, I think, where the Neuralink would come in is 10 plus years, where it would be. But again, who knows? Maybe Elon's already testing this. Who knows what he's doing there?
So when it said, we can do electronic and magnetic, and you were talking about cyborg. So am I going to be able to walk in a room and just think about turning on the lights and they'll turn on?
Potentially. I don't know if it has wireless. I could use your skull as an antenna. But yeah,
put a little tinfoil on there just to magnify it.
No, your skull acts like like its own antenna. That's why when you hold your key up to your chin, you get longer range for your car.
Oh, for your key fob.
Yeah, your key fob.
This is new news. We'll have to make a little.
Really? Oh my God! Yeah. Test it out. Yeah.
Oh. All right. Any last words on this one?
No, this is there's going to be a lot of research needed. And who knows, if we're still doing this podcast in 10 years, we can see where we're at.
Wow,